Hip joint pain is typically caused by arthritic change. It could be due to trauma or inflammation.
What we frequently see is someone who has arthritis who comes into the office. And arthritis can be on the basis of an injury, a previous injury, or an abnormality that occurred when a patient was young, a growth, in a sense, a growth abnormality, or more commonly probably just wear and tear. We see a lot of wear and tear arthritis, particularly since we're all living longer than we used to. People are basically wearing out their joints because of the high activity level that we have these days. Arthritis is, technically speaking, it's inflammation of a joint. What we're dealing with when we talk about potential surgery for patients with hip or knee arthritis is when the joint is worn out, when the cartilage is basically disintegrated, and a person has a situation where there's bone on bone. Also, with severe arthritis, there are many times bone spurs, which will contribute to restriction of range of motion. So patients will frequently be very stiff, and that's basically your body's mechanism to try to keep you from moving a painful arthritic hip. So sometimes we see on an x-ray and see by a clinical exam that someone has quite large spurs, bone spurs, which also need to be potentially removed at the time of surgery. But basically, arthritis is inflammation of the joint, which contributes to destruction of the joint, leading to pain.
The most common form of arthritis is degenerative arthritis or osteoarthritis, which is the natural process of aging and wear and tear in the joint. The second most common cause would be rheumatoid arthritis, which is a disease that actually attacks the joint and destroys it. Traumatic arthritis develops in people who've had trauma to their joints in the past that then hastens the wear and tear and later in life becomes painful.
Hip joint pain can be diagnosed with various modalities. Primary is history and physical, so seeing a doctor is important. We typically would get x-rays the day of your presentation to the office to try to see if there is joint space narrowing, which is typically the way arthritis will show up on x-rays.
A patient who comes with pain in their hip joint needs to be evaluated for other causes of pain. Many times we'll see patients who come in, even referred to us by another physician, or come in on their own with the complaint of hip pain, and it could be coming from their spine, come from their back, from a pinched nerve. It could be coming from the muscles and tendons around the hip, so a careful history and then a physical exam by an experienced hip surgeon or hip physician will help make the diagnosis and correlate that to x-rays. So basically we will talk to a patient, take their history, any other relevant data in, absolutely need to see some x-rays ourselves to help diagnose whether someone actually has arthritis or whether of their hip, or whether it's something else such as a pinched nerve giving referred pain to the hip region, or arthritis from their back, from their sacroiliac joint, or some other cause of buttock pain, or what patients will call hip pain.
First, you generally have pain in the hip. And actually, when your hip is going bad, it's very common to have pain more in the groin area, sometimes on the side of the hip and sometimes on the back of the hip, but the most common place is in the groin. Usually the hip is getting stiff. It gets difficult to tie your shoes. It gets difficult to get in and out of cars. Might be difficult to get up and down out of chairs. Usually your ability to walk is affected. Very often you're walking slower. It hurts when you put weight on that foot, and usually the distance you're able to walk is very often affected, such that you have to stop and take a rest and let your hip recover for a while. And then, of course, x-rays are usually confirmatory and show arthritic changes.
Hip joint pain, and particularly due to arthritis, can be treated with various modalities.
The simplest treatment is Tylenol or an over-the-counter anti-inflammatory such as Advil or Aleve or even aspirin. And early on, those can be quite effective at relieving the discomfort. The next step is to use a cane. The correct way to use a cane is to hold it in the hand opposite of the hip that hurts when you walk, and for every pound of pressure you put on that cane, you take 4 or 5 pounds of pressure off your hip. And so it can make a great difference in how comfortable you are when you walk or how far you can walk.
We can do anti-inflammatory medications, either over the counter to start with, or progress to medications prescribed by a doctor.
Sometimes we will recommend a physical therapy program with a therapist basically working on them with a little bit of hands-on therapy, but then mostly teaching them how to do their own exercises long-term and being their own therapist long-term in conjunction with medications. And then eventually, perhaps we will lead to recommendation for surgery if the arthritis continues to progress or gets to a point where there really are no other options.
Hip replacement surgery should be considered as an option of last resort. We usually will consider this after non-operative management has failed, including physical therapy, weight loss, anti-inflammatory medications, activity modification.
So hip replacement surgery, no matter how successful it is, and it does have a high success rate, is major surgery, and we always want to make sure that a patient has enough problem to justify the potential risk and to go through this big procedure. Typically, patients will have pain and disability on a daily basis and inability to enjoy a good quality of life.
Hip replacement surgery involves replacing the natural joint with an artificial joint. That includes replacing the hip socket with a new socket and replacing the hip ball with a new ball.
There are various ways of doing that through different approaches to the hip, including anterior approach, lateral approach, and posterior approach. It would depend on your body anatomy, your size, and various other aspects that you should discuss with your doctor when planning this surgery.
Hip replacement surgery basically means being admitted to the hospital. The surgery is done with the patient being admitted that morning or that day. And typically the patient will stay in the hospital for 2 or 3 days afterwards, depending on how they're doing after the surgery. The surgery itself takes anywhere from an hour, hour and a half to 2 hours. On a straightforward procedure, it's an incision somewhere about this long. We basically remove the damaged part of the ball and socket joint and replace it with either a metal and plastic components or a metal and ceramic, depending on which type of component is the best one for that particular patient. But in essence, what we're doing is removing the damaged part and replacing it with an artificial prosthetic hip.
The benefit of hip replacement surgery is pain control. This surgery is strictly for pain control. This is not to gain range of motion. This is not to gain an inch of height. This is strictly for pain control. If you have intractable pain or pain that we cannot control other means, that's the reason to do hip replacement.
The potential benefits of hip replacement surgery is increased mobility and hopefully the ability to be able to enjoy a quality of life without having that constant pain and that restriction of motion that patients present with when they have severe arthritis. Hip replacement surgery, like any major surgery, does have some inherent risks in the entire population, that being things like a heart attack or a stroke or a blood clot that goes to our lungs or a major infection. And the risks of one of those bad things happening, like any other big operation, is a little bit less than 1% of the general population that we deal with.
One of the most common complaints that I hear from my patients would be leg length discrepancy, which is leg being shorter or longer than normal. And it is fairly common and should not be changed for at least 6 months to 9 months after surgery. Fracture of the bone as we place the hip, dislocation of the hip, infection, and various problems with healing of the wound.
Artificial hip can get infected more easily than a natural hip. That's especially true during the first 3 months after surgery, but probably true for your whole life. So that gives rise to the recommendation of taking an antibiotic whenever you go to the dentist.
The other risks with joint replacement surgery are potential problems later on in the coming years with loosening or with wearing out of the prosthesis, which has been shown to occur in approximately 5 to 10% of people over a long period of time. So the success rate is generally quoted as approximately 95% of people will get at least 15 years out of a hip replacement. And then after that, we're not quite sure. We don't have the full statistics to back that up, but I always tell patients that it has to bother you enough to take a chance that at some point in your lifetime, you may wear it out and need to have more surgery, and make sure that they understand that and realize that in the vast majority of people, but not in everyone, this can last for a long period of time.
Limitations after hip replacement surgery boil down to hip precautions and activity. Hip precautions, depending on the approach that is used during the hip replacement, may include not bending over 90 degrees, which is the L shape, not turning your toes in and not crossing your legs. And activity modification or activity limitations typically include no high-impact sports, such as running, jumping. We may allow you to play doubles tennis. You may be able to hike, but no running.